Namaskara. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today, we have a renowned pediatric and adolescent endocrinologist, that is Dr. Arun Kumar M. He finished his MD from Rishikesh, that is AIMS, and then did the fellowship from the NAMS, and also he did his work in AIMS in Rishikesh as well as AIMS in Delhi. And apart from that, he worked in the prestigious Lady Hardinge Medical College, and now he is assistant professor of pediatrics in Chelvamba Hospital, attached to the Mysore Medical College, which is one of the oldest and the most prestigious in Karnataka. Welcome, Dr. Arun Kumar.
Thank you, madam.
You know, India has become the capital of diabetes. Everybody says every other person has got diabetes. We all know. But now, even the children have got the diabetes. So, what is that diabetes in children? And what is the difference between the diabetes in children and in adult?
Yes, ma'am. As many people ask me what doctor you are, I tell them that I'm a pediatric endocrinologist and I look after the diabetes in children. People get shocked. Oh, even children get diabetes. Then yes,
Yes.
actually children get diabetes. Diabetes is one of the most common chronic disease in the children that
Hmm.
stays for years and years and lifetime. So that is
Yeah.
the second most common chronic disease in children. And to an approximate, as per a recent study, approximately there are 2 lakh children with diabetes in India in
Hmm.
2025, and the number is
Okay.
expected to go up in the future years, ma'am.
Okay.
So,
So
and
is it a genetic one or inherited from parents, or it is due to the lifestyle like an adult? What is the cause for it?
ma'am, basically the basic pathology in this is a autoimmunity. That the
Hmm.
immunity inside the body, its work is whenever an outside pathogen comes, it has to destroy it.
Okay.
Sometimes due to some autoimmunity, the own immunity of the body will go and destroy the pancreas. Pancreas is
Hmm.
called as the factory of the insulin, where the insulin
Hmm.
is produced in the body. So
Hmm.
because of that autoimmune damage, the pancreas
Hmm.
will stop working. So
Hmm.
that's why these children will get insulin deficiency and they will
Hmm.
land up in type 1 diabetes. The diabetes which is seen in children is called as type 1 diabetes, and the diabetes
Hmm.
which is seen in adults, the elder ones, is called as type 2 diabetes, madam.
Okay. You said the pancreas, which is the factory of insulin, is destroyed. Now, once the insulin production is not there, what exactly happens in the body?
Yes. So whenever we eat some food, like some chapati, some rice, every food have some amount of glucose.
Yes.
Like chapati is food for us, glucose is food for the cells inside the body. Like there are millions of cells, crores of cells inside the body. So
More than
as soon as
60 trillion
yes,
cells in the body, all over
yes,
the body. Every
yes,
cell has to have oxygen, nutrition, and the
yes,
nutrition comes from the sugar. Yeah,
sugar.
that is
So
the
whenever we
glucose.
eat,
Hmm.
that glucose will be complete, that food will be digested and glucose is
Hmm.
released into the blood. The
Hmm.
glucose inside the blood will be circulated to every cell of the body. Once
Hmm.
it reaches the cell, there is
Hmm.
imagine it's a small room. A cell is a
Hmm.
small room. There is a small
Hmm.
gate. That gate
Hmm.
has to be opened for the glucose to enter inside and give nutrition to the cell.
Hmm. Hmm.
So the key for that gate is the insulin. So
Hmm.
whenever we eat, when the glucose rises inside the body will
Hmm.
sense it and it will release the insulin. The insulin
Hmm.
acts as a key, it will come and open the door of that cell and the glucose will
Hmm.
go inside and
Hmm.
final metabolism will be completed. So
Hmm.
because in children with type 1 diabetes, the factory of the insulin itself is damaged and there is no
Damage.
insulin. That's why all these cells, despite the child is eating again and again, these cells
Hmm.
will be completely hungry. They will be asking for more and more food. That's why the child will be asking like, give me more food.
Hmm. Hmm.
So
Hmm.
that is the main
Yeah.
pathology in type 1
Yeah,
diabetes, ma'am.
and despite eating more, the children are very thin compared to the
Yes,
adult diabetics who are very
yes, very
fat and
fat.
obese, and that is the thing. Now, what are the symptoms in these children? Are they same as the adult or different?
Few features will be same. Like most of the times, these days parents are aware regarding diabetes. Whenever a
Hmm.
child passes urine again and again, they will only come to us and ask, sir, please check for the diabetes. Okay,
Hmm.
so we call it as 4 T's.
Hmm.
One is too much of urine, that too
Hmm.
much of toilet he is passing, then the child is
Okay.
always thirsty.
Hmm.
And the child is eating a lot, despite that the child is thin and the child
Hmm.
is always tired.
Hmm.
Remember these four T's. Whenever we
Hmm.
see that there are these symptoms, we should
So
always
four
check
T's
with the
are
dietitian.
tired,
Yes,
and
yes.
yeah, then
T for tired, too much of
hmm.
urine, thirst, and thin.
Okay. Okay. They are thin.
Yes.
Okay. Okay. The four T's are there in the children. Now, what exactly the children, how do you treat them? Is it a challenge? Because adult, you just give tablets and then they take the tablet before food. But here, the tablets may not work. So what exactly, how do you manage?
Yes, ma'am. As we discussed, the main pathology here is absence of insulin. There is no insulin in the
Hmm.
body. So we have to give the insulin.
Hmm.
Unfortunately, insulin cannot be given by mouth because insulin
Hmm.
is a protein which will be,
Yes.
whatever we take, it will go into the stomach. Stomach will have
Yeah.
acid. Acid will completely
Yeah. And
destroy the
that will
insulin.
destroy.
Destroy
Yeah.
the insulin,
Yeah.
so it will be of no use. That's why the only route left will be to give as a injections.
Injections.
So we
Hmm.
give those injections into the skin, which are painless. It should be
Hmm.
very clear that insulin injections are always painless. We have given to insulin to 6 months child
Yeah,
as well.
because
They will be
the
comfortability.
needles are very thin and very
Very thin.
short, and it is
Yes.
just below the skin, and
Yes,
as a
ma'am.
result, it doesn't cause pain.
Doesn't
So,
cause pain.
but only thing that the particular areas are chosen to give. What are the
Yes.
areas and how do you give? Yeah.
Usually we take the areas which will have a good amount of subcutaneous fat and who does
Yeah.
not have any blood vessels and the nerves.
Okay.
So
Okay.
usual areas are the abdomen,
Hmm.
lateral component, that is side part of the thigh,
Hmm.
and the posterior part of the arm.
Are. So
Yes.
you teach the parents first, and as the
Yes, ma'am.
child grows up, the child itself can learn
Yes.
how to take
Yes,
the
ma'am. Yes, ma'am. They
insulin.
always
Is
take.
there
Yes.
a difference between the insulin given in the morning and in the evening, and why the difference?
Yes, ma'am. Usually inside our body, in the daytime, we will be eating every 5 to 6 hourly, morning,
Hmm.
afternoon,
Hmm.
night. Whenever
Hmm.
we eat, the glucose level will go up and the
Hmm.
body will release the insulin. That insulin will
Hmm.
go and sends this glucose into the cell. But
Hmm.
during the night, we eat around 9 o'clock and 10 o'clock and till the morning 8 o'clock completely fasting. During that
Hmm.
fasting also, the body for
Hmm.
the basal metabolic rate and basal function, it needs some glucose. That
Hmm.
glucose will be released from the stores which are
Hmm.
already there inside the liver. Whatever we eat,
Hmm.
that will be stored, extra amount will be stored. So
Hmm.
what happens is in the night also, sometimes the glucose will be released in more amount from the liver. To control
Hmm.
that, body will be releasing some amount of insulin inside the body. So
Hmm.
to simulate the same process, what we
Hmm.
do in children with diabetes is we give insulin, that is a basal insulin, which will be working 24/7 inside the body at night 10 o'clock. That is called as
Hmm.
a glargine insulin. And every
Okay.
time the child eats, that food has to be reached till the cells. So for
Hmm.
that, we give a regular insulin, that is a short acting insulin, which will be
Hmm.
given before every meal. So
Hmm.
this is
Hmm.
called as a basal bolus regimen, which is very much similar to the system which is happening inside the body, and it
Body.
is universally followed in children.
Yeah, and that is the reason, the longevity of children with the diabetic has increased because
Yes,
almost like a natural thing that you are maintaining, and that's the important thing. And here, whenever the parent they come, they ask, now the child is small, there is insulin is not there, so we are giving the insulin as he grows. Can we get rid of the insulin? Can he be normal? That with the question. So, what is your answer for that?
this is the most common question I get in my diabetes clinic, madam.
Hmm.
To be frank, this is a chronic disease. As we
Hmm.
have discussed, the insulin factory itself is damaged. So the
Hmm.
damage is for the lifetime. That's
Hmm.
why they should
Hmm.
take the insulin for the lifetime. It
Hmm.
will be challenging, but it is
Hmm.
possible. And
Hmm.
as the studies have seen, the lifespan in a child with diabetes and
Hmm.
without diabetes, there is no much difference. Without diabetes,
Okay.
this person might live for 80 years. With
Hmm.
diabetes, with good control, he can live up to 75 years. So there is
Wow.
no much
Okay.
difference.
Okay. And I think that is thanks to the human insulin, is it
Yes,
not?
ma'am.
Yeah.
Yes.
What is this human insulin?
Human insulin is the recently recombinantly produced insulins, madam.
Hmm.
Previous year, it before we used to get insulins from the animals. They used to be
Hmm.
extracted from the animal pancreas. But
Okay.
those animal pancreas insulins used to have, those are called as porcine insulins. They used to have lot of reactions. They used to get lot of allergy, lot of swelling, pain. So all those problems have disappeared with the invention of the human insulin. With human insulin, children are very comfortable taking the insulin, and these insulins have become like a pen now. They are not like the
Okay.
fear of that syringe will is gone.
Yeah,
They just
yeah,
have to
correct.
dial it, and they just have to press it. The insulin will be delivered.
Yeah, yeah. So that means the amount of unit of insulin to be given, and that is
Yes.
adjusted, and then just press it and it goes.
Yes,
And
ma'am.
in adults, they have the monitor attached. Do you have for the children also? And
Yes, ma'am.
can the children be trained like that? What is
Yes,
it?
actually, that is called as continuous glucose monitoring. Like
Yes.
while checking the blood sugars in a day, we advise for self-monitoring of blood glucose. We call it as SMBG. We advise for
Okay.
7 times, like before
Hmm.
the meal and after the meal. They have to check and they have to see how is the control. And at
Hmm.
night or 2 o'clock also, we advise them to see how is the night control. But
Hmm.
here I have only 7 point of the blood glucose. What is
Hmm.
happening in between? I don't know. So
Yes.
to combat this problem, the recent years there is an invention called as continuous glucose monitor. What it
Hmm.
is there is a small sensor which will be
Hmm.
fixed behind the arm.
Ah.
So that will
Hmm.
be checking the blood glucose every 5 minutes. So and that will
Okay.
be recorded. So that will
Okay.
record and that will give me a continuous plot that at 12 o'clock this much was sugar was there. At 4 o'clock you
Oh.
did walking. At 4:30 glucose came down. You ate this food. This
Oh.
amount of glucose has raised, and that will be
Wow.
recorded in the phone. They can send me over their phone. I can also see here and I can advise them what you have to do.
Wow, that is really amazing.
Yes,
So
ma'am.
this becomes very easy to adjust. So
Yes.
earlier the nature used to adjust, and now you are adjusting
Yes.
depending on what they are doing. So what they have to eat, when to eat, everything can be given in a nutshell to them so that they
Yes.
can have a normal lifespan. The adult, we give the tablets. Do they work in children or no?
No, ma'am. Like there are very rare varieties of diabetes. We call it as 0.0001% who will have that variety. I'll not talk
Hmm,
about them. If we
hmm,
consider type 1 diabetes, which is the most
hmm,
common, like 99% of the children, type 1 diabetes is the commoner one in children. So
hmm,
in them, whenever we have to give any tablet, it will go to the stomach. If we
hmm,
give the insulin, it will completely get destroyed because it is a protein. And
hmm.
in children, the main pathology is the absence of the insulin. The key itself
Yes,
is not there. But in
not there.
adults, key is there, that is not working.
They
That's why we are
not
giving some
working
medications and we are opening
to
some back door.
stimulate it back door.
Yes,
Yeah,
yes,
yeah,
yes,
yeah, yeah. So the two mechanisms are different. So the treatment also have to be different.
yes, ma'am. Yes,
Okay. Now I'll ask you a rapid question.
yes, ma'am.
Uh, you just answer yes or no.
Yes,
So the junk food, yes or no?
definitely no
No.
for the children.
Yeah. And lifespan can be normal, and parent need not be worried. Yes or no?
Yes, absolutely normal given the blood glucose are within normal limits.
Normal. Okay. The insulin injection is not a curse. It is a boon to them. Yes or no?
Absolutely 100% it's a boon, ma'am.
Yeah. And people need not worry about the future, because today, even if the kidney damage is there, the liver, the pancreas transplant has come, which is very,
Yes,
very successful. And
yes.
as a result, the parents need not worry. So, is it a morbid condition, or the mortality is high, or is it a normal disorder?
It's a routine disease, just like we all have hair fall. It's just similar to that. That
Okay.
diabetes will be there. It's just an insulin deficiency inside the body. You just have to give insulin from outside. There is
Yeah.
no salt in the food. Just put the salt and we eat. So it's just
Yes.
as
Yes.
simple and as
Yeah,
similar as it is.
it is just a disorder of
Yes,
lack of insulin
yes.
rather than a disease. But if you don't want the diseases to occur, it has to be controlled well.
Control.
Thank you
Yeah.
very much, Dr. Arun Kumar, for explaining so beautifully, so nicely. Thank you.
Thank you, madam. Thank you very much.